not walk fast.
Here at Georgia College, we are not immune to students abusing drugs. Research is currently being done on campus to better understand prescription drug abuse, or what student Scott York calls a dark area of research.
This is like a field of drugs that gets left out a lot. People don't think about prescription drugs when you think about drug abuse. You think about things you learn about in DARE, like cocaine.
York has found that amphetamines were the most commonly used amongst students, which includes prescribed ADD and ADHD medications such as Adderall, Ritalin, and Vyvanse. The National Institute on Drug Abuse found similar results, saying that prescription and over-the-counter drugs are, after marijuana and alcohol, the most commonly abused substances by Americans 14 and older. Is it the collegiate atmosphere or the availability of the drugs that's pushing students to take medications?
You know, just like the general American culture, as we realize that prescription drugs are becoming more of a problem for abuse and illicit use in the general public, then we're starting to see those problems emerge on the college campus as well.
Criminal justice professor Carrie Cook thinks that whatever is causing the issue, that resources need to become available for students who suffer from this kind of drug abuse. Cook's research here at Georgia College began with a focus on criminal victimization.
In victimization, I mean victimization, criminal victimization, so whether it's assault or identity theft or sexual assault.
She realized there was a link between these crimes and incapacitative drugs, such as prescription pills. While conducting her research, she realized she needed more student responses and enrolled Scott York to help. York believes there is a strong link between prescription drug abuse and Greek life.
You can pull this off of any Hollywood movie. Drug dealers need trust, stuff like that.
York's research was a specific sample of 585 students from random classes that looked at differences with students who are or are not affiliated with Greek life. York says that these tight networks are one of the main selling points of Greek organizations, but it is these networks of trust that also enable students to have the resources to find drugs. The survey did not focus on prescription or illicitness of participants' use, but whether or not they had used the drug before. The results of the survey have inspired York to do a focus group to discover more about the culture of these drugs. This is Jenna Howard reporting for GC360.